This video will cover the organs, organ systems, and body cavities that we covered in lab during our first week of class. So the first one we looked at was the respiratory system, which in general is really just to move air in and out of your lungs. And we've got the lungs themselves, of course, but we also have our trachea, which a lot of people would call their windpipe, but of course we'll call it the trachea. Your larynx, your voice box, you can feel that right there in the front of your neck. Also, we talked about the cover of the lungs being the pleura, and we'll talk more about those at the end. But yeah, we're just trying to get air from the environment into our lungs and get that air back out. The trachea leads to these smaller tubes called bronchi. That's plural, and bronchus is singular. So if you're talking about one, then you would say the left main bronchus. If you're talking about a bunch of them, you would say bronchi. Of course, you've heard of bronchitis, probably. The cardiovascular system really is to circulate blood around the body using arteries and veins. And the cardiovascular system star might be the heart, but first we'll look a little bit at these arteries and veins. The blood vessels carry the blood often away from the heart to the heart, and we talked about the aorta being that big giant artery that runs down the chest cavity, thoracic cavity, and the abdomen. You can't see it very well on here, the inferior and superior vena cava, but these are these big veins that carry blood in the abdomen and in the chest back to the heart. And we'll talk later about the pericardium, which protects the heart. So yeah, there right now highlighted was the aorta. The aorta really runs all the way from the heart down to about your hip level, carries blood in a downward direction, and then the inferior vena cava sort of parallels it and carries blood back up. You can see some of those veins there that you would use to give blood there in the arm. I just wanted to show a closer look at the heart, the kind of star of the cardiovascular system. You can see the valves there, and this happens to be the tricuspid and the pulmonary valves. All right, we didn't talk a lot about the endocrine system, but the one gland that did show up on our torsos when we were looking was this thyroid gland. It's really closely associated with the larynx right there, kind of in the front anterior part of the neck. So endocrine system, we're thinking hormones. The thyroid gland, the hormones are really being produced to regulate our body metabolism, our body activity. Next week went over the urinary system. The right on top of that kidney there, you barely saw, was the adrenal gland, which is actually part of the endocrine system. But yeah, our urinary system is really our kidneys, the ureter, which you can see there, that tube which runs and drains on one side anyway to our bladder. There's two ureters. Our bladder then empties through that little inlet outlet there called the urethra. This is the female, so that's the female urethra there, at least the opening that we could see. So again, our kidneys basically filter our blood and create this liquid from the blood called urine, and that urine travels from the kidneys to the bladder through the ureter, and then out of your body from the bladder through the urethra. And that's the urinary system. Digestive system is probably the most complex just because there's so many parts, but one of the places where we start the digestive system, our food goes from our mouth or oral cavity into the pharynx. And from the pharynx, you can travel on down through the esophagus, which you can see here. That leads to your stomach. You can't really see the stomach here yet, but if we remove some stuff, you can see that big pouch is the stomach connecting to the esophagus. The stomach then holds the food, and the food eventually makes it into your intestines, starting in the small intestines, which are the coiled up ones you can see there. After the small intestine are the large intestine. The parts are usually referred to as the colon, and from there to the rectum and on out. And we'll go over some more detail on the digestive system in a bit, but just because this is a female, you can actually see the bladder You can see, couldn't really see the uterus there, but I was trying to highlight that. All right, I wanted to show sort of the relationship between the pharynx and larynx. So there's your nasal and oral cavities, right? You can't really see half the tongue's gone there, but behind your oral cavity is your pharynx, your throat. And so we'll take a little trip into the pharynx. So here now we're inside, our camera view is in the pharynx, and you can see a couple openings now from the inferior portion of the pharynx. You can see the esophagus, that's your food tube. You can also see the larynx there has an opening called the glottis. That opening is to the inferior part of the larynx and eventually to the trachea below that. You can see the vocal cords, right? Those vibrate as you expire, create your voice. So this is part of your larynx as well. Air travels through there, food travels through there. You may have heard of the epiglottis. Some of you, the epiglottis helps protect. When you want to swallow, you got to squeeze that airway shut. Epiglottis helps do that, and then the food goes back towards the esophagus. Remember, the esophagus is posterior to the larynx, posterior to the trachea. Now we're going to move through your vocal folds, and now we are in your trachea. In this tube, it looks like it's ringed with lines or lined with rings because it has these cartilage rings. And then there's two little inlets there, continue from the trachea. Those are the main bronchi, the right and left main bronchus. All right, so that's kind of a internal view. All right, a little more about our abdominal organs and some of those cavities and things coming up. This animated view is a lot like the torsos that you're studying in lab. I wanted to make sure you could see the spleen on here. It's kind of tucked way back there, but if you see, it's only on the left side. It's kind of on the peeking around the stomach. There's the gallbladder. The gallbladder is kind of hidden by the big liver. I can't really see the bladder. I was trying to show that. Let's look at a little more detail about the intestines. So the small intestine has three parts, the duodenum, jejunum, and ileum. The stomach leads to the duodenum, which is the first part. It's really short, just like a foot long. Then the jejunum, maybe 7 feet, I don't know, don't quote me. And then next, distally farther, would be the ileum, and that's the end of the small intestine. Here you can see it highlighting the ileum, the jejunum, and the duodenum, kind of go in reverse order there, getting closer to the stomach. For the large intestine, it kind of circles around the small intestine on the perimeter, and it's got a thicker diameter. The ileum is the end of the small intestine. That leads into something called the cecum. The cecum's the start of the large intestine. It's also the location of the appendix. Then you have an ascending colon, transverse colon, which cuts across in the front right under the stomach, the descending colon, the twisting and turning sigmoid colon. It's kind of makes like an S shape. And then the final part of the large intestine is the rectum with the anus. Of course, our digestive system is all about getting nutrients digested. That's the pancreas. I had to remove the stomach in order for you to be able to see the pancreas. So it's deep. It's at the very back. It's actually attached to the back wall of the abdomen. You can also get a good view of the kidneys there, the spleen. So we pulled out most of the major abdominal organs were deep in the wall. Aorta, inferior vena cava, all viewed here. So this would be like the poster on the back of lab that's got that very deep view. You can see the aorta, inferior vena cava really well. You can also get a good view now of the respiratory diaphragm, or just diaphragm, which separates a couple cavities, which we're going to talk about, the abdominal pelvic cavity, abdominal cavity, and the thoracic cavity. The diaphragm is skeletal muscle. You use it every time you voluntarily take a breath in. You can see holes for the vena cava, esophagus, and aorta in that respiratory diaphragm. We also talked a little bit about protective covers for these organs that are in your body cavities. So, for example, you've got your cranial and spinal cavity, which protect your brain and spinal cord, and that has protective covers called the meninges. So here's a quick look at your cranial cavity, which houses the brain. And there's actually 3 layers of meninges. I just figured we'd learn the dura mater, the thickest, most superficial cover that protects the brain. There's a couple other covers and cerebrospinal fluid. We'll learn that later. There you can get a good look at the brain. You can see that whitish cover that you can't see through. That's the dura mater. It's real thick, made of connective tissue like collagen, things like that, protecting the brain. On the outside of that would be the cranial bones. The next protective layer and cavity we'll talk about is in the thoracic cavity. We have the pleura. The pleura are around the lungs. Pericardium we'll do next is actually around the heart. So the pleura actually are a double layer. One layer of pleura is stuck to the inside of the chest wall. The other layer of pleura is actually the outer layer of the lung itself. So the parietal layer of the pleura is stuck to the chest wall. The visceral layer of the pleura is the outer layer of the lung. In between them is the pleural cavity, sometimes called the intrapleural space. In between the lungs is a region called the mediastinum. There's several structures in there, including the heart. Covering the heart is the pericardium. The pericardium's outer layer, it's a double layer as well. The outer layer I've cut away here is the parietal pericardium. It's the thicker layer kind of away from the heart like a bag. The visceral pericardium is actually the outer heart wall. In between them is a little bit of fluid, and so you've got a little tiny pericardial space or pericardial cavity. If you pull those layers away, and you can see the heart wall. The peritoneum is a double layer protecting organs within the abdominal cavity and some in the pelvis too, so the abdominal pelvic cavity. Again, there's a parietal and visceral layer of the peritoneum. The parietal layer is stuck against the inside of the abdominal wall, whereas the visceral layer is actually the outer layer of the organs themselves. Sandwiched between is a tiny bit of space, and that's the peritoneal cavity. Or intraperitoneal space. Here you can see if we cut away that outer layer, the parietal peritoneum, you can see that there is this little space created around the organs between the visceral and parietal peritoneum. Again, there's a little bit of fluid in there, and that would be the peritoneal cavity. The outer layer of the organs is the visceral peritoneum. And so this covers not only the abdominal organs, but even like the top of the bladder and the uterus and some of the pelvic organs as well. That's the peritoneum. All right, see you guys in class.